Since its foundation, the organisation has been calling for the following: an immediate and permanent ceasefire by Hamas and the Israeli government, the release and safe return of all remaining hostages held by Hamas, the release and safe return of the thousands of Palestinians abducted and detained without charge or trial by the Israeli government, an end to the almost total blockade of Gaza, and full access to Gaza for all aid agencies. Today's vigil is in someone's home, just attended by core group members. In about 2 weeks, we'll be holding our vigil outside on the steps of Liverpool Lime Street Station. Time and date to be confirmed.
The healthcare infrastructure in Israel is intact, as it should be. Hospitals, primary care centres, clinics, pharmacies, ambulance services, intact and functioning to provide quality healthcare. The surface-to-air missiles fired by Hamas are largely intercepted by Israel's Iron Dome air defence system and have not, to our knowledge, damaged any healthcare infrastructure. Israel's infrastructure is not subjected to mass bombing from fighter jets. Hamas doesn't have fighter jets. Israeli infrastructure is not subjected to attacks by tanks. Hamas does not have tanks and is not present on the ground in Israel. Hamas militia attacked the Israel border region on October the 7th and then returned to Gaza. Sadly, 4 Israeli healthcare workers were amongst those killed during the attacks on October the 7th. We are not aware of any other healthcare workers or any additional civilians at all being killed in Israel since that day.
The healthcare infrastructure in Gaza is decimated, subjected to attacks by bombs from fighter jets and missiles from tanks, troops on the ground, the Israeli army having invaded the Palestinian territory of Gaza in October 2023. Forced evacuation of some hospitals has already occurred, with abduction of healthcare workers. 3 hospitals in the north of Gaza have now been issued with the same evacuation orders. All civilians in the north of Gaza have been ordered by the Israeli government to leave or starve. 3 days ago, the United Nations Independent International Commission of Inquiry on the Occupied Palestinian Territories said in a new report, Israel has perpetrated a concerted policy to destroy Gaza's healthcare system as a part of a broader assault on Gaza, committing war crimes and the crime against humanity of extermination, with relentless and deliberate attacks on medical personnel and facilities. The deaths of 595 healthcare workers have been verified by the organisation Healthcare Workers Watch. Another 420 reports of killed healthcare workers are currently being checked. In addition, 300 healthcare workers have been abducted and are being detained by the Israeli occupation forces.
Volunteer healthcare workers have travelled to Gaza to support the remaining exhausted Palestinian healthcare workers. On their return, many have written accounts of their experiences. We're going to read today excerpts from some of that feedback. This first article was published in The Guardian 6 days ago with the headline Post-Apocalyptic. Thank you. UK volunteer surgeons reflect on time in Gaza. Health workers fear for safety and say the level of casualties and conditions are unlike anything they have seen before. When Dr. Amar Dawish went to Gaza in January 2024 as a volunteer medic, his team narrowly escaped an Israeli airstrike on their accommodation. By the time he returned in August, the level of destruction, the severity of patient injuries, and the lack of essentials in the territory had significantly worsened. Gaza is one of the worst missions that I've done, especially this time around. It has affected me and affected the whole team, said Darwish, a general and major trauma surgeon from Manchester, who has also worked in Syria, Yemen, Iraq, Libya and Ukraine. Saving one life is good enough reason to go back, said Darwish, who returned from a volunteer mission with medical aid for Palestine in Gaza last month.
Nearly a year into the war, The Guardian spoke to a volunteer healthcare worker from the UK who had travelled to Gaza in recent months. They called on the British government to evacuate patients, apply pressure for an immediate ceasefire, and push for opening of aid corridors, as essential supplies remain at the Egyptian border. At overcrowded hospitals, medics report operating without essentials such as surgical gowns and gauze. Malnutrition is also a huge problem, according to doctors, along with worsening sanitation and the limited access to water. Polio vaccination started last month, but a brutal reality is that some of the children being vaccinated will be seen as casualties in the evening. I really cannot imagine how things will become in 2 months' time. He said, after what I have seen, I would really ask our UK government, our Prime Minister, to push forward and to put pressure on all sides to have an immediate permanent ceasefire and to allow medical aid, and also to protect civilians and protect medics and medical facilities. They are unprotected, they are unsafe.
This article was written by American surgeons Mark Perlmutter and Feroz Sidwa in July. The article has the title, "We volunteered at a Gaza hospital. What we saw was unspeakable." In the United States, we would never dream of operating on anyone without consent, let alone a malnourished and barely conscious 9-year-old girl in septic shock. Nevertheless, when we saw Juri, that's exactly what we did. We have no idea how Juri ended up in the Gaza European Hospital preoperative area. All we could see was that she had an external fixator, a scaffold of metal pins and rods, on her left leg, and necrotic skin on her face and arms from the explosion that tore her little body to shreds. Just touching her blankets elicited shrieks of pain and terror. She was slowly dying, so we decided to take the risk of anesthetizing her without knowing exactly what we would find. In the operating room, we examined Juri from head to toe. This beautiful, meek little girl was missing 2 inches of her left femur, along with most of the muscle and skin on the back of her thigh. Both of her buttocks were flayed open, cutting so deeply through flesh that the lowest bones in her pelvis were exposed. As we swept our hands through this topography of cruelty, maggots fell in clumps onto the operating room table. Feroz muttered, "She's just a child." The two of us are humanitarian surgeons. Together, in our combined 57 years of volunteering, we've worked on more than 40 surgical missions in developing countries in 4 continents. We're used to working in disaster and war zones, of being on intimate terms with death and carnage and despair. None of that prepared us for what we saw in Gaza this spring. The constant begging for money, the malnourished population, the open sewage, all of that was familiar to us as veteran war zone doctors. But add in the incredible population density, the overwhelming numbers of badly maimed children and amputees, the constant hum of drones, the smell of explosives and gunpowder, not to mention the constant earth-shaking explosions, and it's no wonder that UNICEF has declared the Gaza Strip as the world's most dangerous place to be a child.
Dr. Anna Gilani is a paediatric orthopaedic surgeon from Liverpool who travelled to Gaza's Al-Aqsa hospital in March. She said the government has failed to recognise the actual concerns that we have as humanitarian aid workers. Dr. Gilani said the UK had failed to take a single patient from Gaza. The United Arab Emirates, Spain, European Union have evacuated severely sick and injured patients, according to the World Health Organization. Dr. Gilani said, "I work in a trust that openly accepted Ukrainian refugees and provided them cancer care, NHS care, and we have been told we cannot accept patients from Gaza because the government have not allowed this. How can we be a developed country and not allow a single patient into our hospitals when there is such a massive man-made catastrophe happening?"
The Geneva Conventions and international humanitarian law established the rules to protect health care in armed conflict. They include the following: medical personnel must be respected and protected. Civilian hospitals and other medical facilities must be respected and protected and cannot be attacked. Medical transport must be respected and protected. The wounded and sick must be respected and protected. The deliberate attack on a protected medical facility, personnel, or transport is a war crime.
The UK government is still providing military aid to the Israeli government despite the war crimes being committed. Since October, Israel has been granted impunity. The 4 most senior Labour MPs are members of Labour Friends of Israel. They have remained friends despite the crimes committed. If this is an issue about which you feel strongly, then please write to your MP and ask them to use their voice to call for a ceasefire and an arms embargo on Israel. You'll find their email contact details and their constituency address just with a simple Google search.
So thank you again for joining us. This and other recordings will become available soon on our recently created YouTube channel. More information on the medical situation in the occupied territories and Lebanon can be found on the Facebook and Instagram pages of the main Healthcare Workers for Palestine group. Thank you again.
Thank you. Well done, guys. That was better, wasn't it?